start by, I've gone through general survey, I've gone through checking my patient's ID band, allergies, awake, alert, and oriented ×4, pain assessment to see if you have any questions for me. I've asked my pain questions. We're going to begin. Okay, so I'm just going to play Mr. Jeremy. Is that fine? Okay, Mr. Jeremy, is it okay if I begin your assessment? I'm going to start by assessing your scalp.
No problem.
Okay, so I'm going to come around to the back of my patient, and I'm going to be looking at my patient's scalp. I'm looking at the skin integrity of the scalp. I'm looking to see if I see any rashes, lesions, excoriations, palpating my patient's scalp for any lumps or bumps, noting the hair distribution, noting the texture and thickness of the hair, also looking at my patient's hygiene, appears to be well groomed, and checking the occiput of the neck for any lice and also for any early signs of skin breakdown, since that's a bony prominence. I don't see any non-blanchable redness at the occiput, so then I'll make my way down. I'm going to check next at the backs of the shoulders, the backs of the scapula, the backs of both elbows, the back of the sacrum, and then last would be the heels. And at all of those locations, I did not see any signs of skin breakdown, any non-blanchable redness. Obviously, in class, you guys are assessing scrubs. On your real patient, you need to be exposing the skin. All your gowns will open in the back, so it's very easy for you to have access to check that skin integrity on the back, okay? All right, so then after I've checked the heels, I'm gonna be down on my patient's feet already, so that's a great time to go ahead and check Jeremy's shoes for capillary refill. So I'm gonna go ahead and I'm gonna push on the nail beds of his toes, and I'm going to push down and release, and I wanna see that that blood flow returns in less than 3 seconds, which it does, which is a normal finding. And then while I'm down here, since I'm here, I did not mention this to you, I'm also looking at my patient's ankles and feet, and I'm looking for any edema or swelling, which could be a sign of a cardio problem or trauma, which is also called edema when you see swelling there, and I don't see any edema. So I'm gonna come up to your fingernails. I'm gonna take a look at your nail beds here. I'm gonna give a little press on the nail bed and release. And again, on both hands, looking to see that that cap refill comes back in 2 seconds or less, which it does, so that's a normal finding. The next test is called clubbing. I'm gonna have you take your pointer fingers for me. One little test here, put your first knuckle in and hold that up. And he does, it is little, but he does have a diamond there, so that's a negative finding for clubbing. And next test is for skin turgor. So I'm gonna squeeze your forearm. This is a test for tenting. Gentle squeeze and release, his skin snaps right back, which is a negative finding for tenting, which means he has good elasticity and is well hydrated. Do you have a mole today that you'd like me to take a look at that is of concern to you? Just say yes.
Sure.
All right.
Yes, I do.
All right, this mole right here, it looks overly concerning. I'm going to walk you through some of the signs that this mole may be something that you would want to get looked at further. First is the symmetry of the mole. It is symmetric, it's round and equal on both sides, which is a normal finding. The border appears to be well defined. It's not jagged or faded. The color is light brown. Has it always been light brown? Yes. All right. The diameter is less than a pencil eraser. It is very minimally elevated, pretty flat with the skin. Has it changed at all since you first noticed it? No. All right. And it's not firm. It feels like the same texture of the skin, and it hasn't changed, so that includes that it has not grown in size. Is that correct? Yes. Okay. So based on my assessment of that acronym, there's not any signs that warrant further workup. However, if you are concerned, there's something to be said for, what do you call it, like your own intuition. You should go ahead and still recommend getting that looked at, especially here in sunny Florida. And just so you guys know, you all get to get a dermatology check is included in your well checks every year now. So go to your dermatologist for your insurance. Sidebar. Okay, next. We're going to go ahead, I'm going to move to your back. While I'm moving to your back, I'm inspecting the AP to lateral ratio is 1:2, which is a normal finding, negative for a barrel chest. Jeremy, I'm going to be now palpating your spine for any pain or tenderness. So can you roll your shoulders forward for me? Thank you, like you're hunched over. There you go. And then I'm going to find the top of his spine, and my thumb on one side, fingers on the other. It's like a rocking motion back and forth, working my way down his spine, asking him if he has any pain or tenderness. Any pain or tenderness thus far? No. Let me know. Still good? Mm-hmm. All the way down to the sacroiliac joint. All right, Mr. Jeremy, any pain here?
A little bit.
A little bit? Okay. Well, how would you rate that? 0 to 10?
A 3.
A 3. Okay. Had you have any like recent trauma there, or you just sit too much?
I I said.
Sue your skinny brain. I'll have a little pain there now. All right, we'll walk around a little bit. We'll check it again. All right, the next test is for CVA tenderness. I'm going to be doing some light taps on your back. If it causes you pain at any time, let me know. Starting on this side. Any pain?
No.
All right, and then on the other side. Any pain?
No.
All right, so that's negative for CVA tenderness. Now we'll begin your respiratory assessment. We're going to start with you having you take some deep breaths. I'm going to have you take a series of 10 deep breaths in and out through your mouth, nice and big breaths. And if you get tired or winded, dizzy at any point, let me know and we can take a break. Sound good?
Sounds good.
All right. I'm not going to actually have them do the breaths just for the sake of your time, but finding approximately the 10th rib, so where the bottom of the rib cage is, coming up about 2 spaces, I would guess about here would be the 10th rib. I would have him go ahead and take a big deep breath in and out. Go ahead, do one for me. And then, again, my stethoscope would be in my ears, listening all the way to the end of the exhale before I move my stethoscope.